My name is Frank Murchison. I'm an ophthalmologist, a medical doctor with the Baptist Eye Surgeons. I've been here since 1994. I do general ophthalmology, but I did a fellowship training in corneal transplantation and ocular surface and infectious disease. So I do cataract surgery with lens implants. I do LASIK surgery. We've been doing LASIK surgery here since it began pretty much. And then I do corneal transplantation. LASIK eye surgery is where there are two structures in your eye that focus light, your cornea and your lens. So if you don't already have a cataract, we can change the refractive state of your eye by changing the shape of the cornea. So LASIK surgery is a surgery which we reshape the cornea by means of creating a flap, which we used to use a blade, not anymore, we use a laser, and then lay the flap back, and the second laser reshapes the cornea to correct the optical correction or refractive error of the eye. And it's been quite amazing. And it's been going on since approved in 1999. So we've been doing it for a long time, and there's been updates in technology which have made it a much more effective procedure. So LASIK surgery is primarily used to correct distance vision. So if you wear glasses or contacts for distance, you might be able to alleviate the chance of needing those glasses and contacts. Once you're in your 40s, you're going to experience the natural loss of reading vision called presbyopia, which means it's old eyes. So LASIK, you still may need reading glasses after LASIK surgery if you're over 40. So there's two parts to the procedure. The first is the flap. We use a suction ring that fits on the eye. That pressure you can definitely feel that pressure. Some folks experience more than others. We do numb the eye with the drops, and you have an anti-anxiety medicine on board, Valium, which helps a lot. And that part of the procedure is usually 30 seconds or less. So the pressure you feel from making the flap is about all you'll feel. No, no, it's usually pretty quick. You go home, and with the Valium on board, you typically will sleep for most of the rest of the day, which really helps the recovery of the eye. Usually about 20 minutes on average. Usually we're actually doing something to the eye for a few minutes or less per eye, but overall about 20 minutes. It usually does not. So I did two patients yesterday, and they're both driving today and right at 20/20 uncorrected. That's not everybody, but most people, the recovery is pretty quick, and you can return to fairly normal activity pretty quickly. Some folks have a little bit of dryness after LASIK, which you're on some eye drops for about 4 or 5 days and you use some artificial tears, but usually you can return to normal activity very quickly. So that's a very good question. We offer a free evaluation where we'll do all the testing to make sure you're a good candidate. In the early days in 1999, when it first was approved, we didn't have these new tools that help us to decide whether you're a good candidate or not. But with the newer technology, specifically the eye design and the pentacam, we can look at your cornea, make sure you don't have anything unusual that would make you not a good candidate, and also evaluate, make sure you don't have a cataract or something else going on with the retina or so forth. So we offer a free evaluation to make sure you're a good candidate.